from Henry Ford Jackson Hospital, diabetes care specialist, Sarah Chapel. Hi, Sarah.
Hi, nice to see you again.
Yeah, welcome to the show.
Thank you.
Oh, your whole family's been on the show before.
I know, they've all
Yeah.
been here.
Yep, your mom Sue.
Yep.
And your sister Amy. I don't think Jean's been on.
You should get them in.
Yeah, and you've had, and is that the whole family?
I have another sister, but she lives in California, so.
Oh, okay.
Yep.
Well, maybe someday if she ever comes for a visit, we'll try to get her on.
There you go.
Yeah. So diabetes in our community, it's always been one of our big health problems.
Yes.
Right? Now you spend time educating. What does a diabetes educator do?
So I'm a part of the care team, and my role is to really help people with diabetes understand their condition and just give them more knowledge and skills, because this is a lifelong journey to help better manage their diabetes. So it's not just a one and done. So we want to make sure they have all the skills and support they need.
Yeah, it's not something you get like the flu.
Right.
But like the flu, you don't want to get diabetes either.
Correct.
Is there a way, can people that are not yet diabetic, can they prevent?
Yeah. There's a lot you could do to prevent it. I think it's kind of knowing your risk factors. So if there's a family history, or if you're not active, if you're carrying more body weight, if you have high blood pressure, if blood sugars have been a little higher in the past, those are all risk factors. So it's important to know those risk factors so you can make changes to delay or prevent diabetes for yourself.
So is that why it's called the lifestyle disease?
Yeah, it's a chronic condition, so we want to make sure we're managing the duration of that disease, because with uncontrolled diabetes, then we're at higher risk for other things like kidney disease and high blood pressure. And
all right, so knowing the risk factors, maybe you can't do anything about high blood pressure as an example.
Sure,
maybe you can't do anything about the risk factors, but are there things that you can do to avoid becoming diabetic?
Yep. So a lot of you can't change family history or genetics, but you can change how physically active you are. You can change what you're eating, how much you're eating, the timing of meals. You can change, not smoking, taking medication. So there's a lot of other behaviors that are really key.
Change what you can.
Change what you can. Do your best,
yeah.
right? I mean.
So pre-diabetes, that's something, to me it seems like it's a rather new term. Pre-diabetes?
It's not a new term. I think that it's, even you hear it more, which I think is good to bring it up, because pre-diabetes is when your blood sugars are running higher than normal, but it's not quite to the level of being diagnosed with diabetes. So I think people hear this pre word and they think, well, it's a pre-problem, but really this is critical time it's a red flag that your body's working harder to maintain blood sugars. So there's a lot of things you can do at this stage to revert back to normal blood sugars before it progresses to diabetes.
So you can be pre-diabetic, and then you can reverse that and not be pre-diabetic anymore?
Yes, with changes, right?
And there's not a pill?
There are some medications that can be started then, but a lot of it's really lifestyle change, watching what you're eating, managing stress, being more active.
Stress. Can stress contribute to developing diabetes?
Absolutely.
Really?
So stress does raise blood sugars.
Oh, no kidding.
Yeah.
Huh.
So it could be a lifestyle stress or just life stress, work, family, home, that kind of thing. That can kind of sometimes put people over the edge.
Chill, and
yes.
You could, all right, diet. So we've got, all the reasons we all know. We shouldn't overeat, we shouldn't eat certain foods, but are there recommendations of what kinds of foods, what people should eat, maybe when?
Yep, when, how much, those are all really, really critical. So I'm a registered dietitian in addition to a diabetes education
You're a
specialist.
dietitian?
Yes.
Okay.
So we talk a lot about creating a meal plan, and again, something that's going to be sustainable, because if people are making all these changes at once, I don't think that's going to work more than a few days. So we want to make sure that we're really setting people up for success. So it's maybe, a few less chips, and maybe it's more salads, or a little less potato, more broccoli, that kind of thing. So it's really helping people with a sustainable plan.
Now we're in Lent, so if somebody were to give up maybe fried foods as
Sure,
an example
sure.
Over Lent, is that enough time that you would see some measurable change?
You would probably feel different, and if you do have diabetes and are checking blood sugars, you would probably see that in your numbers when you're monitoring that at home. But again, we want to make sure that it's. But I've had patients too give something up, and then once Lent's over, they're back at it.
Yeah.
So again, we want to think long term and.
Now,
What's
years ago,
sustainable?
people called this disease sugar diabetes before, long 50s, 40s. But what is the relationship with sugar to diabetes?
Yep. So when we eat foods, our body is going to break that food down into sugar or glucose, and that's our body's main fuel source. So normally what happens is when your blood sugars start to go up after a meal, it will. Your body makes a hormone called insulin, and that insulin helps to get that sugar delivered to all the cells of the body. With diabetes, it's a problem with not making as much insulin, or your body not using that insulin like it should, and so your blood sugars do stay higher.
So if somebody's numbers are way low, does someone like grab a candy bar? Is that
If it's low, a low blood sugar, we would have them do something that's really fast to raise your blood sugar, like having a half cup of juice or regular soda, hard candy, something that's just straight sugar.
Okay.
Yeah.
All right, so let's talk about meals. Breakfast. We have a lot of people that they skip meals. They're on these diets where you fast for 12 hours. And what are the, I guess, implications of diets, fad diets in particular, that would affect someone's, I guess, chance of becoming pre-diabetic?
Yeah. So if people are fasting, what we tend to see is that at some point of the day they're going to be eating to make that up, right? So we want to make sure we're assessing that, and then it kind of comes into how much and how often. And but there is some research saying that if we're not eating as much as our meals, that does help with the diabetes development or progression.
What about breakfast? Some people like smoothies at breakfast. Is that a good meal or
Yes,
meal
smoothies
replacement?
are tricky because depending on how you make them, it's usually fruit, yogurt, milk, and those are all carbohydrate foods that can raise blood sugars or will raise blood sugars. Some people make smoothies with more protein powder and vegetables. So we first want to clarify what exactly is in the smoothie and how much of the smoothie are you drinking, because you could take a cup of strawberries and condense them down just to a very small amount in a blender, but people tend to drink a big smoothie, which
Right.
again has
You
a
wouldn't
bigger
eat a whole pint of strawberries, but you could drink one
real quick.
real
Yeah.
quick. All right, what about carbs like pizza, bread, pasta? Everyone loves all that.
Sure.
Is
And I
there danger to eating too much of
Yeah,
that?
well, I think that stuff can still fit in, and that's what we teach people is how much can your body handle, right? But looking at the bigger meal, what are you pairing it with? So if it's a small amount of pasta as a side dish with chicken or beef or pork and lots of vegetables, that's going to have a very different impact than just
A
a
big
whole
bowl of
plate
pasta with garlic bread,
Exactly.
which is really the way it should be eaten,
Well,
but not every day.
not every day.
There's sugar-free candies.
Yeah.
Does the body recognize those any differently than?
We want to check the labels too, because sometimes if you look at the sugar on the food label, it'll say 0, but if you look at that total carbohydrate, there will be a number there. And foods with carbohydrates do raise blood sugar, so it's something to be mindful of, that it's not a free food or something you can have as much as you'd like.
So what you can eat, how you eat, that's one implication. But I hear a lot about people having problems with circulation in their feet
Yes.
when they are diabetic. What's the relationship to that?
Yeah, when your blood sugars are running too high, that can cause some damage to those blood vessels. And so we can see tightening of arteries, we can see reduced blood flow, decreased circulation. And then people also can they just have a loss of sensation with their feet. So maybe they don't feel hot or cold very well, or they might step on something and not notice there's you
Walk
know.
through a room of Legos and not even know it.
Exactly.
I have a friend who's got, I think it's neuropathy.
Neuropathy.
Is that a sign that?
Yep. So it's that nerve damage. And we could see it kind of throughout the body. Sometimes people have a hard time, again, it affects their feet or their hands. Sometimes it does affect, their stomach, where their stomach doesn't empty like it should, just from nerve damage. So,
And I bet you've seen in your years, people have had their
Yes.
had amputations.
absolutely.
Right.
Yep. But again, I encourage people just to make sure that they are doing their part, taking a really active role in their care,
Wow.
knowing what their numbers are, right?
So you can be pre-diabetic and then erase that, reverse that. What about once you become diabetic? Can you reverse?
I've seen people do it.
Really? Wow.
Yep. And if you've had diabetes for 20 years, it's not going to happen, right? You're not going to go back to normal. But it's usually as people that are newly diagnosed, and it depends on what your blood sugars are, where are you at when you've been diagnosed.
How bad are you?
Where are you at? Yeah. Yeah,
All right.
but I've seen that happen too.
Is it typical, because you mentioned family history and lifestyle, is it typical that you'll see more than one person in a family with diabetes?
Yeah. Yep. That happens a lot. I always ask who in your family has diabetes, and sometimes there's usually more than one. Sometimes there's 5, 10 people in the family. So it's very strong.
And it's
risk
possible
factors.
they're eating the same foods.
Environment might be the same, or they've
Yeah.
exactly.
All right, so let's say you have someone in your family. They come home and they say, "Hey, I'm pre-diabetic. I got to make some changes." How can you help make it easier for that person to cope and maybe reverse it?
Right. So I think it's knowing what that person with diabetes or prediabetes needs for support.
Okay.
Sometimes it's just listening to them. Sometimes it's helping, create a healthier meal plan, or buying foods a little differently than what you did before. Maybe it's going for a walk together, just engaging in some healthy behaviors together.
And the byproduct is you'll be healthier too.
Yes. So it benefits
Yes.
everybody.
Yeah, everybody. It's a win-win. So what kinds of diabetes management resources can people get from you and Henry Ford?
Yep. So we have a full diabetes education program. So we do a lot of group classes. We do one-on-one, but we really target all those key behaviors that do help improve diabetes management. So healthy eating and being active and reducing stress. So
Sarah, it turns out, knows what she's talking about because Sarah was recently honored with the 2023 Sally Joy Leadership Award from the Diabetes Partners in Action Coalition of Michigan. Congratulations.
thank you.
That's pretty cool. So this honor was given to Sarah in recognition of Sarah's consistent efforts to improve the lives of those living with diabetes. So your colleagues at Henry Ford said it's not just her job. She really cares about her patients and really wants to make an impact in the lives of her patients. So that's pretty cool.
Thank you.
Congrats.
Thank you.
So if somebody with diabetes or prediabetes wants to be connected to you and
Sure.
all the resources you have at Henry Ford, how do they go about it?
Yep. So you need a physician's referral, but we have all of our information online at henryford.com. If you search under services and under diabetes, you'll see our location and phone number.
Nice. And I think getting a referral is as easy as just going on my chart and you can connect with your doctor, and that can happen all.
It's pretty quick.
Yeah. Nice. Well, great.
Yep.
Thanks for coming in today.
Thank you so much.
And congratulations on the award.
Thank you very much.
From Henry Ford Jackson Hospital, diabetes care specialist, Sarah Chapel. Next on